COVID-19 is an infectious disease caused by the recently discovered coronavirus. So, what are the symptoms of COVID-19? There are three main common symptoms such as fever, dry cough, and tiredness. However, some patients do have milder symptoms such as runny nose or sore throat or back pains, and even some people may not have any symptoms and may feel well even when they have the virus. Most people, around 80%, do not need any form of special treatment to combat the disease. However, 1 in 6 people may be seriously ill and may develop breathing problems, such as older people or people with already existing medical issues. By now, you already know so many things, but let me quickly take you through the important ones. So, number 1, wash your hands. Make sure you regularly wash your hands with soap and water, or when you're outside, make sure you have a hand sanitizer, an alcohol-based one, and make sure you regularly sanitize your hand. However, prioritizing washing your hand is very important. Number 2, make sure you don't touch your eyes, your nose, and your mouth. And number 3, make sure there's a 1 meter distance between you and between anyone who's coughing or sneezing or who is a potential patient for the virus. And most importantly, make sure you and everyone around you practice good respiratory hygiene, meaning when you're coughing or when you're sneezing, you use your elbow to cover it or you use a tissue that you immediately dispose after. When it comes to COVID-19, there's a flood of false information out there. So today we're going to walk you through the facts and the myth of COVID-19.
A very common myth is that there's a certain type of food or alcohol that will help prevent you from getting COVID-19.
And that is a myth. The fact is, eating healthy food and having a balanced diet and exercise will help strengthen your immune system, which is very good in combating the virus once it comes. Myth number 2.
If you hold your breath for 10 seconds, you do not have COVID-19.
That is false. According to professionals, even young people who have the virus are able to hold their breath for more than 10 seconds, and older people are less likely to be able to do it. Myth number 3.
If you drink water, the virus will leave your throat to your stomach acids that will kill it.
That is wrong. The virus does go through the throat opening, but it penetrates the cell and there's no way of washing it down through using water. Although it's good to hydrate, but you're most likely just end up going to the bathroom, not having the virus. And the final most common myth is
social isolation is not needed. The virus is not a big deal and you'll see it after all.
The idea is that, and the fact is that, social isolation is needed. And if we see a reduction in the number of cases that have the virus, it's a further proof that social isolation works, not that the virus is not a big deal. So the advice we will give you is, make sure you don't publish any false information and cross-check your facts before sharing it from trusted sources such as the World Health Organization, the CDC, and domestic sources such as the Ministry of Health that is always translated by VOIS Cyprus. Do not panic. If you notice that you're stressed, make sure you reduce the amount of times you use your phone and listen to news, because stress actually reduces your immune system. Number 3, make sure you look out for the vulnerable in society, from elderly people and from those who are already sick. Call your friends and family and ask them if they need any form of help or assistance. And finally, wash your hands. In fact, wash your hands now after viewing this video.